Welcome back to the Faculty Factory podcast, friends. It's Kim Skorupski here at UTMB in Galveston, Texas, the University of Texas Medical Branch, where Galveston once was the leading gambling and entertainment capital west of the Mississippi. Yes, Las Vegas patterned itself after us. Again, thanks for these tidbits to Dr. Charles Mouton, our Executive Vice President, Provost, and Executive Dean. And with me today on the podcast is Dr. Claudia Hilton. Hi, Claudia. Did you know that used to be the gambling capital? The
Hi,
biggest
Kim.
one?
I guess I did know that we were kind of a model for early gambling in Las Vegas. I did actually know that.
Oh, super exciting. I had no
Yeah.
idea. I'm learning so much about Texas. Well, friends, you just heard from my friend and colleague, Dr. Claudia Hilton. I met her when I moved here 6 months ago and was so impressed with her. Let me tell you about her. Dr. Hilton is a professor. Indeed, she is a distinguished teaching professor in the Department of Occupational Therapy in the School of Health Professions here at UTMB. And Dr. Hilton, when I first met her, she was talking about the systematic reviews that she does with her learners and early career faculty, and was talking about this process of how everyone's getting this scholarship. They're learning about science, they're learning to be critical thinkers. And I was just really taken by the process that you've built and like your history of doing systematic reviews with students. So I was hoping you could be on the podcast today, Claudia, to talk about how this idea came up, just kind of give folks some food for thought out there. So take it away, Claudia.
Okay. Well, thanks, Kim. Yeah. So, I have had naysayers from other departments say to me, "You can't do systematic reviews with students," and but we've had, about 20 of them already published. So I say, yes, we can. But there are certain things that you need to consider before, to make it successful. And not every one that we do is published. So, they're not always published, but it does give the students a lot of good practice in looking at the literature, trying to understand it better. It's part of my research classes. So, kind of instead of just talking about methods and statistics, we're actually using things, and they have to kind of delve into the studies that have already been done. Your first question, though, about how I came up with the idea, so is my daughter, who's also an occupational therapist, had to do one in her graduate program, and they never published, so they just kind of went through the motions, and I had never done a systematic review, and I thought, wow, this is something that would be valuable because you kind of the systematic review looks at like the lay of the land of what has been done and what's the current status on certain areas of scholarship, or what do we know about this topic. So it really helps get you started with research, like what's the next step? What do we need to study next? What are the important takeaways from this? And beyond that, into practice, like what should therapists do? What's the best way to address these different conditions? I mean, we want to do best practice. And how do we do that? We have to kind of compare different intervention, methods, and we have to figure out how can we do the best thing for our clients. So that's kind of the bottom line of it. And so the first, well, so how I set it up is I actually teach both of the research classes in our program, in our doctoral student program. So we have, Research 1 and Research 2, and we start the systematic reviews in Research 1. And so the first step that I always do is ask faculty. It's not just OT faculty, it's people in other departments can also be involved. And we've had some in other departments, in other schools, even outside of UTMB. But to give me topics that they might want to have a systematic review done on. And they have to agree that they will mentor the group of students as far as the topic area, because I help them with the process, but I don't always know all the topics as in depth as,
Sure.
it's not that's not, you can't know everything.
Right.
So I mostly kind of coordinate, although I have several that are just my topics. But so I ask all the faculty and outside people, whoever I run into, if they have topics, that it has to be related to occupational therapy. So, that's kind of the bottom line because that's the courses that we're teaching. But, so they give me a list of topics, and then I try to have about 5 students per group do these reviews. And that I share the topics that the faculty are willing to mentor with the students. And the students, I tell them, pick something that is dear to your heart that you really want to know about, because this is a lot of work and you're going to be working up for quite 2 semesters. So you need to pick something that you really care about. So that's kind of the first step. You got to get your faculty involved, and your students have to be interested in the topic. And, sometimes, they kind of negotiate and figure out what's worth it and who they want to work with. There's some of that goes on. But, and then once they've come up with their topic idea, we need to make sure that the systematic review hasn't been done already, because
Right.
faculty don't always know that. And so we bring in our excellent library expert, who is so wonderful, Allison Hanson. She is so good. She knows everything about systematic review. So she's like the guru of, how to do the searches. She goes out, she teaches the students, I have her come in and talk to them about how to do searches, look for, previously done systematic reviews, and start pulling up the number of articles. I try to, because this isn't necessarily their whole career doing the systematic review, I tell them to, find some kind of topic that is approximately 15 articles are going to come up that you need to review, because you can't review hundreds of articles. So if you're going to review some topic that's fairly highly published on, you need to pick some real specific area of it, or some, limit it in some way that you're not going to get overwhelming number of articles to review, because that's really not the point. We want them to get a taste of it and to walk through it, but not spend the rest of their life working on it. So that's kind of the first thing they need to do. And the librarian is so great of, helping, looking for other articles. We teach them that program called Covidence, which is a really nice program that organizes these articles and helps them to collect them. And then they can, they go through this process of, they kind of within their group and guided by their mentors, they come up with which articles, are fit into their criteria. Like they might say, what age group, what diagnostic group. It has to be something about something with OT. So they come up with their topics and their mentors. And then the first semester, I have them just do their review and their methods. So they find these articles and they put them into an evidence table. And it just kind of, it's like a shorthand of all the articles, and it just tells, the basics of what was included in each of the studies they looked at. And so I was thinking, for example, if, you might want to know what kind of things they've done. So one of the things that we actually had an article that was used as a guiding article for a policy statement in the American Occupational Therapy Association on the effects of dry needling. We looked at it, for spasticity and range of motion. A lot of, I don't know if you've heard of dry needling, but it's a little bit similar to acupuncture, but it's deeper, and it goes into, instead of doing it surface on the meridians like acupuncture, it goes deep into the tissue, and it can really it's used a lot for reducing pain. But we looked at it for some other, spasticity and range of motion, and it became very highly cited within the American Occupational Therapy Association. So we're pretty excited about, that was carried some weight with our colleagues. So anyway, that's one of our things. We've also done some pretty neat things on, like, how to combat loneliness in older adults, things with animals. We looked at this recent group they looked at animals and to see how well they addressed loneliness. And they found that the fake animals were as good as real animals.
No way. No way.
It was really funny.
I have something else to hold over my dog's head when they mess up. I can replace you.
Yeah.
I will have no deleterious effects.
That's right. That's right. I mean, who knew, right? But so that one hasn't been published yet, but we're working on it. But so anyway, the first semester we just come out with getting the articles together and trying to figure out what they're telling us. We go through and they kind of work within their group and they follow the protocols with systematic reviews, what all you have to talk about and explaining how you did the search and what were your inclusion, which type of studies were included and which types were excluded, what the dates were, maybe what age groups, the diagnosis, the types of interventions, anything, that narrows down what you're going to include in your review. So they go through that first semester, and this is part of their, assignments, but it gives them a lot of good exposure to how we talk about research and how we measure things and statistics that are used. So it gives them a hands-on, besides learning those things, they get to read about them and understand, and hopefully to increase their understanding of how to, what do these data mean? How to interpret them. So the second semester, they come back and they do the rest of the review. So that's when they do, the literature review, like why do we do this systematic review? Why is this topic important? They have to go back and, explain that. And they have to talk about, what were the results then? They have to explain that. And then they discuss what does it mean and what can we conclude from it? So how strong are the data supporting this type of intervention? Or what does it mean for therapy? What does it mean for research? What's the next step? What does it mean for teaching? What should we be teaching something more in our programs? That kind of thing. So, but yeah, so we've had some pretty fun things like we looked at electronic use with musculoskeletal, if they have issues from doing electronics too much with young adults. We looked at that because that's something that we might see in our practice. People with hand injuries because they've overused their little fingers in too much electronic usage. So that's one thing we were published about. We looked at robotics in stroke rehab to increase upper extremity function. So, how well that did. We looked at yoga and balance with people with neuromuscular impairments to see, and so we can, from these systematic reviews, looking at the level of the evidence in these studies, we can come out saying, how strong is the evidence supporting these kind of interventions. So, some of the things are strong evidence and some are just kind of emerging. So, sometimes if there's not enough studies and they're not strong enough, we have to do what's called a scoping review. And that would be one that, you just don't have enough data to call it a systematic review. So we've had some scoping reviews too, where like right now, one of our groups is still working on a scoping review about human trafficking and looking at trauma-focused cognitive behavioral therapy and looking at yoga, dealing with people who've been involved in human trafficking. So we have that kind of topic we're working on. Another group's working on OT interventions for adults with complex regional pain syndrome, which, like sometimes people get really problems with pain that doesn't go away. And so what are the things we can do to try to improve that? What are the choices of interventions and which ones are the best, evidence? What do we know that has the strongest success rate on that. So those kind of things are really good. Um, One of the recent ones that we've just submitted for publication that we just got accepted at the International Autism Conference this year is on, we're looking at attitudes about restricted and repetitive behaviors with children with autism. So those are things like, hand flapping, or um, they might be, or having to have things in order, having to always know what's coming up next, being real like um, um, only want to do things one way, like certain colors, certain dishes they like to use, certain clothing they want to wear, the things that are just repetitive and restrictive. And there's like a whole the takeaway from this review is that autistic adults are saying some of our repetitive behaviors, like the hand flapping, or even like fidgets, things that they do that don't bother anybody really. They're kind of disruptive, but really they don't bother people, like that they're calming and they can be kind of therapeutic. So let's not throw the baby out with the bathwater on these repetitive behaviors. Like some of them are okay. So we need to look at them differently. They're not always bad. They're bad if they hurt people, and they're bad if they cause damage, or, break furniture. There's certain things that could be bad, but a lot of them are not bad. So kind of to restructure how we think about that. And a lot of the research in autism is kind of looking at more from the perspective of autistic people. It's like autistic people have certain needs, and they're not always bad. Even if they're kind of odd, they're sometimes fine. It's like, just get used to it. You're not hurting anybody. Let's just give them a break. And, so that's when we're pretty excited about that one, because we're looking at kind of a different viewpoint on that. And, so that's going to be presented, in a few months in Seattle in the autism conference. So, and then yeah. So those are some of the topics. I don't know if
Well,
is there.
yeah. Well, it's super fascinating, and I can see why you've been given, the honor of being a distinguished teaching professor here at UTMB. And so, first of all, congratulations, Claudia. I love this project and this approach so much, because I started off in teaching back in the day, teaching sociology courses and statistics and methods. And you're right, the experiential learning, the actual doing and applying what you're learning, kind of connecting those dots is critical. And I can only imagine the sense of pride in the students, in your learners going, well, not only are they checking a box and doing the required elements of a course to get a grade, but they're can then put something on their CVs, on their resumes, that they actually have a scholarly publication, that they are
Right.
presenting at a national or international conference.
Right.
They have this sense of expertise about, I imagine, when they go into a job in private practice or in academic health or whatever they do, that starting off with that in-depth knowledge about a topic and
Right.
a process, a scientific method, really must give them such incredible confidence and pride, like I said. And now, so I think just wonderful, and I love that I know, I can only imagine, I know how much work it is to corral the faculty members and get the lists and organize the students and making sure everybody's pulling their weight, and all the things that are involved in that kind of endeavor. So I guess I was curious and I wanted to ask about, how do you get the faculty members? You said earlier that sometimes they're not only internal, and certainly not in occupational therapy here necessarily, but in other departments in the school or health profession, and even external to UTMB. I imagine that you've kind of built up a reputation that faculty members can say, hey, especially early career faculty members would say, gosh, I'd love to be able to do a systematic review or get a scoping review out there, or to get some real deep dive into this topic. And I'm so pressured by fill in the blank, seeing patients, teaching my own courses, trying to get my whatever is published, serving on these committees, um, doing all these other things that sometimes, as we all know, our scholarship gets pushed to the bottom of the list. So this to me is a win, not only for your learners, but for the early career faculty members who like, wow, this is great. I'm gonna get a publication and I'm also mentoring and teaching. And so it's everything seems like you're hitting all across all the bells. But can you talk to us more about the other side of it, the faculty side, getting them engaged, keeping them engaged, making sure that they are indeed mentoring these students and guiding them? Can you talk us through that process, how that's worked for you?
Um, Yeah, those are good questions. So the faculty. So how I get people, I just start chatting with people, at meetings and at different scholarly, research discussions or whatever, and I kind of pitch it out there. That's kind of how I get people. And it does, like you said, it takes a little time to mentor. So not everybody wants to do it. So, we only do people who want to do it. And so it's not all of our faculty participate in OT even, but the ones that do, they benefit. And I think the more they do it, they kind of see that it's quite valuable, especially if they're kind of, needing some publications. It really helps.
Yeah, I can imagine them getting ready to think about a grant application or
Yeah.
establish their career, path or portfolio, and they think, gosh, I just need to really get into this literature that will really get me a head start on my next step. Well, this is kind of a ready-made program that would
Yeah.
really kind of like be the catalyst. So I can imagine all kinds of collaborations and just kind of wins for the faculty member. Can you tell us, talk us through the pitch? What do you say to people when you meet people? You'd be like, hey, Kim, I know I just heard you say that you wish you had time to do more about blah, blah, blah. Let me tell you
Yeah.
about are you literally do the car salesman thing? Let me tell you, I got a package for you today.
Yeah, so I kind of do that. It's like, our students could probably help you with that. I mean, the students, because it's like this huge amount of manpower, 5 students. I mean, okay, they're not always all the students aren't as productive as everyone else, in their group. But when you get 5 together, a lot of times you get a pretty nice group and they come up with, pretty insightful, valuable thoughts. Now they don't, it does require the faculty. I try to cover as much as I can to try to support them without the faculty because, it is a burden on faculty, but it pays off. That's kind of the thing, and I think I try to kind of publicize, well, these 5, just got published. So you guys could be part of this. I try to do it like that to show them, and this stuff happens. It's
Yeah.
not like I'm not making this up. These are new pubs that have happened and they're not in junky journals. We get in some pretty, I mean, not jam 'em, but pretty nice journals, pretty nice professional and specific uh, types of diagnostic group journals is the kind of what we go for. So people read them, they get cited. I mean, um, I some of the faculty, you know, they've kind of learned that this really is beneficial as they kind of see the products of each year, so it kind of builds in its kind of value. But and not all the groups, it's not always successful. And sometimes, now one of the pitfalls is, so you're supposed to register systematic reviews. There's several agencies that will register them, but to kind of get like dibs on it, so people don't waste their time doing reviews on topics that someone is already working on a review for. So sometimes another pub will come out right when we're getting ready to submit ours. It's kind of on a topic that's too close. Yeah, it's like, oh no. So, but like I said, not everyone gets published. So, we have maybe a third every year, third to a half that get published.
Wow, that's
Um,
a pretty good rate, though.
but it depends on the students too. Like a lot of times, um, in order to get faculty, I encourage faculty, but I also encourage students to lean on their faculty. I say especially when you're coming up with your topic and your articles that are, that you want to include in your review, you need to have a real clear understanding and discussion with the faculty member to kind of be sure that you're doing the right, group, that you're getting because students, the argument is that students don't know enough to be able to advise, on these things. Well, the faculty do, and that's the kind of their role. And then when we have, to kind of look at the discussion part of these, what does it mean?
Right.
Well, the faculty really need to be involved there. So I really pressure the students to lean on the faculty and make it as easy for faculty as possible. It's like to try to, do as much. So we do a very structured procedure on it of, when things are due, all the steps that are included. They get very structured grading rubrics on each thing. So I try to, keep them going through this process so the faculty aren't burdened by all the process. And the librarian is she's just so great about, if we need to look again, do another search to come up with some of these topics kind of move quickly. So you have to kind of really keep on top of them because things
Yeah.
change so fast and there's new research. So
Yeah.
the librarian, she'll keep it up and she'll give them updates and she'll do another extra search to see if anything new pops up. And they do get notifications too. They sign up for notifications of any new articles that come out while they're working on the review. So we do have some nice structural support in this process, keeping all that really laid out very carefully. And that takes a lot of burden off faculty and even faculty. So it gets down to a lot of faculty have never done a systematic review, and it's like, you can do it.
Yeah.
Because
And you're, like you said, you're taking the burden off the faculty members to go, oh, geez, I got to figure this all out. No, you're handing them a template for how we do it. And I think it's so important. And I love how you brought in the medical informationists. I mean, at Hopkins, those are some of our favorite people, the medical informationists,
yeah,
because they had access to databases and search processes that we regular folks don't know. And
yeah,
that's such
yeah.
a gem versus going onto the Google and doing a search. So
Right,
just
right,
even that, making learners aware of real data, real truth, real evidence, and how you find that, and then, as you pointed out, interpret it and make meaning of it. Even if
right.
they don't publish or present, that process of inquiry, I'm sure, sticks with them as they then go into into practice and learn to be systematic in their diagnosis and their treatment plans and their follow-up. And so I just think it's wonderful, and I can envision this technique being replicated in any practice or any field, because
Right.
certainly anybody needs to have a good lay of the land when you're going to start publishing in something, especially if you don't, like you're saying, if it's something brand new or you're making a brand new foray into it. And so why not, um, don't go solo on it? Why not leverage learners, students, early career faculty who, it's a quick way to you know, get caught up on a method and to get some early successes, early wins, and then maybe whet their appetite for doing more.
Right, right. Well, here's another complicating factor is the rules change on these too. So, okay, so you said about one author doing their own systematic review. Usually nowadays, journals will not publish systematic reviews with only one author because they need to have that collective kind of
Mhm.
decisions about which, it's kind of subjective a little bit which articles are included. So it makes it a stronger review if you have several authors kind of deciding, which articles to include. And but also like the process changes. So the registration agency for the biggest one is called Prospero. And that one, for a while, all they accepted were things on COVID. And so we were having a lot of trouble getting our things registered. And I kind of leaned on the librarian. Like there's a whole science in library science. She keeps up on all this latest stuff. And she gave us other options. Like we don't have to always do Prospero. So that really helped us. It really opened up, like, cause we were like, now what are we supposed to do? And so that having her as a colleague with this is very helpful to our success because I as an occupational therapy faculty, it's not, it's kind of like computers. Like I know things, but for me to stay expert is kind of like a full-time job. And so for her, she stays expert in this stuff. She's into systematic reviews. She knows, she keeps up on everything. And so I just ask her, and she's really our expert on the process and, the most current issues. And so that really helps us, with that particular hump because
Yeah.
I think that's a burden for a lot of faculty too. It's like, how do what else? You can read a lot of systematic reviews and, look at different journals and how they, the rules change. So you have to
Yeah.
kind of know, the current rules and you have to be kind of, go through the steps or you're not going to get things published. So that's something that's, really helps us. If you can get your ally in the library, you're really helping yourself.
Well, I love the interdisciplinary nature of occupational therapy and the health professions. Just so natural for you. You're not even kind of calling attention to it, but it's just so evident in how you work when you were giving the list of the titles and the topics that it's just the nature of your field to be interdisciplinary. So I think another lesson that I'd like to underscore is for all of us to broaden our scope, our lens, our frame, and say, how can I be truly more interdisciplinary beyond what I think is traditional being interdisciplinary? How can I go into other industries, other fields? How can I use library and private practice and another industry altogether, engineering or business? And how can I get those, as you pointed out, other brains or eyeballs on something to lend different perspective? Because that's only going to be richer. I think many of us realize that the days of the solo investigator are long gone. I remember when I was a postdoc, there were a couple heavy hitters in my field, gerontology, epidemiology, who would just be publishing left and right all by themselves. I'm like, how do they do that? But like these days, it doesn't happen. It's very, very rare. So what you're doing to me is another good example of how we can do interdisciplinary team science.
Yeah, yeah. And you open up a whole nother, you know, collaborative idea of really collaborating with real tightly with other departments that have similar, interests that we could do even better than we do, kind of from our occupational therapy focus, but just kind of quality of life or, successful adaptation to different kinds of issues, that's really good ideas.
I
Getting
just
the
always
teams.
think I love talking. I love doing this podcast just because I learn so much and I get so excited and ideas. I can just see you, Claudia, taking students through the hospital or through an engineering plant or a business setting and just doing the whole kind of walking around and observing where you think that so many times any of us or anywhere we think, gosh, why do they do it that way? Don't they know that if they just do this, then that? Or, I mean, the silly example that I think I've given before in the podcast, and this is so ridiculous. You're going to be like, what are you talking about? But with that necessity being the mother of invention, that you walk out of a public restroom and we all like flick the door with our elbow or with the heel of our shoe, and we're scooting out with our paper towels in our hand. And then we have paper towels in our hand. And then the silly thing was always like, why don't they put garbage bags or garbage containers right at the door so they know that we're going to scoot or use our hand with a paper towel and then we want to throw it. So the idea of watching behavior, watching physician or practitioner patient interchanges or exchanges, and having a light bulb moment, like, or standing at someone's shoulder and watching them type something and say, didn't you know that if you just do Control F7, you can, oh no, I had no idea that we can all help each other out by, did you know?
Yeah.
And I think that interdisciplinary team science, a catalyst kind of programs where you just get people in a room together or people in a space together to observe and to improve things. I just think that's what you're doing, is you're starting those wheels in motion of being curious. And so hopefully I'm confident that organically what you're doing is creating that sense of, innovation by being curious. And I think there's so many more cool things we could do to, as you said, deliberately innovate by putting people in a room together or in a space together and just say, we're going to go there, and kind of, we're all going to come out with, we all have to have at least one idea about how to improve the patient experience or the
Yeah.
customer experience.
Yeah, you open up some pretty interesting ideas for future potential. I like that. Like us working with engineers on adaptive equipment, some kind of like devices that might be useful because we know the problems and we know the issues, in the body, but what can you do to make that work in the real world? And like, there's so many things like that we could, work together to make things better. That's great. Yeah, I
Yeah,
like that.
this has been a great conversation, Dr. Claudia Hilton, and I really appreciate you coming on the podcast. I'm going to leave the last word to you, but I'm going to again thank you so much for sharing this process, and I think it's been very helpful, and hopefully we've inspired and you've encouraged other people to give it a go. But up to you,
Uh,
Claudia. You say the
uh,
last word.
Okay, well, I guess my last tips would be, it's a team effort. Get your people, they need to have some kind of skin in the game, that this is important to them, and get your librarian on board. And the students are so valuable. They have so much excitement and energy, and, you can get publications that you can be successful in this. This is not crazy. And maybe you don't get 100% published, but it's still a good experience for everybody who's involved. Thanks for having me, Kim. I really appreciate it. It was enjoyable.
That was Dr. Claudia Hilton. You can email her to learn more about her process at CL Hilton, Hilton. So it's CLHILTON at UTMB.edu. Come back on the podcast next time. Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.